My name is Mitchell Myers. I'm a native Texan. I was born and raised in Waco. Some of the more common orthopedic procedures that I've performed would be shoulder, hip, and knee replacement, carpal tunnel release, trigger finger release, meniscus repairs, ACL reconstructions, and rotator cuff repair. So in order to maintain orthopedic health, the biggest thing is keeping your BMI or your body mass index within a normal range, keeping your weight down and staying active. Those are the best things you can do to stay healthy and fit. So signs that would indicate somebody would need to see an orthopedic specialist would be any injury to the musculoskeletal system. So shoulder, hip, knee, wrist, hand, any of those things. If you have a bony injury or a tendinous injury or a muscular injury, any of those would be signs to see an orthopedic surgeon, or if you have any debilitating arthritis. Common treatment options for pathologies like rotator cuff tears typically involves a trial of corticosteroid injections and physical therapy, depending on whether the tear is a full thickness or a partial thickness. And then if non-operative treatment options fail, then we can talk about going with the scope and fixing it arthroscopically. As far as ACL tears, those typically always require reconstruction. Conditions like arthritis that are more chronic in nature, I typically start with a more conservative approach, so that includes corticosteroid injections and physical therapy. If those fail, then I have a discussion with the patient about moving on to surgical treatment options such as knee replacement. For conditions like osteoporosis, I typically have the patient start on a calcium and vitamin D supplement. There's things like vitamin D levels and DEXA scans that can be obtained, and then from there, we have treatment options like bisphosphonate therapies to increase bone density. So the typical recovery process after an orthopedic surgery depends on the surgery that you have. Conditions like knee, shoulder, and hip arthritis where a replacement is done, those patients are able to walk the same day of surgery with physical therapy. If it's a fracture that we're fixing, it usually takes about 6 to 8 weeks for bone to heal before we let the patient start using it. So for patients who have an orthopedic condition that are hesitant about seeking medical help, my advice would be to make an appointment with an orthopedic surgeon. There's no commitment by doing that. There's no pressure to perform any kind of surgery. It's just an open dialogue to figure out what's the best treatment option for you, whether that involves surgery or not. The way technology has improved diagnostics and treatment options, advancement in imaging techniques, so our MRIs are getting more advanced and the detail is improving, and that makes it easier to pick up on small pathologies within the knee or the shoulder or whatever we're imaging, and we're able to use that to come up with a better treatment plan for the patient and diagnose problems earlier.